In the Welsh Centre for Burns, we were concerned about the number of children we were seeing anecdotally with steam inhalation injuries, and that prompted us to look back over our figures for the last 5 years to see how many paediatric patients, children aged under the age of 16, had come into us with scald injuries caused by steam inhalation for the common cold. When we looked back over our figures, we found that we had 16 in a 5-year period, and we reviewed all of their notes to find out what their indication for steam inhalation was, what injuries they'd had, how big their burns were, how long they'd been in hospital for, and how much their treatment had cost as a result of their burn injury from a healthcare point of view. Of course, that doesn't take into account the personal cost of their injury to them and their family. Because we were keen to raise awareness of this, and there isn't a lot in the published literature raising concerns about steam inhalation, we wrote an article for the British Journal of General Practitioners, which has been accepted, and hoping that we could get the word back out to primary care that although it gives short-term symptomatic relief from having a cold, steam inhalation actually runs risks of causing preventable burn injuries. After we'd done that and we'd sent all that off, we had another child admitted to us in July, which isn't even cough and cold season, who had a very significant burn injury from his steam inhalation, and he'd knocked a bowl of boiling water off a stool, and it had hit him on his lower abdomen, his groins and his legs, giving him a 15 to 20% burn, which necessitated trips to theatre and a stay in intensive care, and unfortunately for him a repeat admission with sepsis when he was very, very unwell. We were very concerned about his outcomes following his injury.
We thought he had hay fever. Nurses in the surgery thought it was a cold, so we suggested that we steam thinly. So we steamed him over a bowl of water, which hadn't boiled, but it was obviously hot. Placed a towel over his head. His dad and I were either side of him, and I just said, when you need to move, let me know. And as I said that, Finley just moved his head and pulled the water all over his legs.
When I got off the chair, I was in shock, and I didn't know what to do. So my dad told me to go into the shower, and then they were just putting cold water onto me.
We didn't think they were that bad at the beginning. We just thought his skin was going to be a bit pink. He was wrapped in cling film straight away. But as soon as we got to hospital, we realised then how bad they were, because they said they were about 17% of his body. They were only superficial burns, but they were still really quite bad.
And that prompted me to make an appointment to see people at the Welsh Assembly to see whether we could get a bulletin out in the Chief Medical Officer's bulletins before the cough-cold season starts properly, to let the GPs know about our concerns and to ask that steam inhalation is not recommended for symptom relief, because although it may help in the short term, actually the long-term impact of the injuries that we're seeing is much, much worse than having the common cold.
I just wouldn't ever put hot water by the children ever again, and I wouldn't recommend anybody else do it.